Welcome to the ANP review channel. In this video I will review two different anatomical models for the lab to review different types of muscles in the upper limb. If you're looking for the lower limb, for the torso, or for the head and neck, I have different videos. You can look at those videos. Also, I have a different video for the function of the muscle and also for the lecture related muscle functions and different structures of the skeletal muscle. So this is the lateral view and this is the posterior view. Deltoid muscle, infraspinatus muscle, teres minor, teres major. Biceps brachii, so this is the anteriorly located. Brachialis and triceps brachii. This is triceps brachii. Posterior view, this is the lateral view. The deltoid, you can see it from anterior view, from lateral view, or from the posterior view. This is a different model, same muscles. So deltoid, infraspinatus, teres minor, teres major, biceps brachii, brachialis, triceps brachii. Similar to the previous image. This is the lateral view and this is the posterior view. This is the medial view. So subscapularis muscle, this one. This is teres major. And this is just a tendon of the latissimus dorsi. This is biceps brachii, coracobrachialis, brachialis muscle, and triceps brachii. Same muscles in a different model. So subscapularis muscle, teres major, biceps brachii, coracobrachialis, which is difficult to see it here, brachialis, and the triceps brachii. Forearm, so it's anterior view and posterior view. This is the posterior view. Most of the muscles in the posterior views are extensors. Extensor digitorum, so look at these tendons where they go. So they are going to these digits. Then you have the extensor digiti minimi. This is actually a deeper muscle. It's shown here at the same level, but it's actually deeper. So this goes to the small finger. Extensor carpi ulnaris, anconius, flexor carpi ulnaris, and extensor retinaculum. Different model. So this is the brachyradialis. You can see part of it. Extensor carpi radialis longus. This is the extensor carpi radialis brevis. This is the abductor pollicis longus. This is the extensor pollicis brevis. And this is the tendon for extensor pollicis longus. Extensor digitorum, look at it, goes to different digits. Extensor digiti minimi. Extensor carpi ulnaris. A different view. Brachyradialis. Extensor carpi radialis longus. Extensor carpi radialis brevis. Abductor pollicis longus. Extensor pollicis brevis. This is the extensor pollicis longus. And also you have the extensor digitorum. This one. This will be extensor digiti minimi. It's difficult to see from this view. So this is extensor digitorum. This is the anterior view, and this is the medial view of the forearm. So extensor carpi radialis brevis, a little hard to see it here in this one. And then as you have the extensor carpi radialis longus, brachyradialis, pronator teres, flexor carpi radialis. Always look at the thumb. So the way the thumb is, this is lateral, so this is radialis located that way. So the medial side is the ulnaris one, because ulna is located medially. Palmaris longus. See, this one goes superficial because it goes to the palm of the hand. The other ones are passing through this flexor retinaculum. Flexor digitorum superficialis. So this is a second layer. So like a middle layer of anterior muscles of the forearm. So flexor digitorum superficialis. And flexor carpi ulnaris, again, is difficult to see. This is at the border, lower border, or medial border, I should say, of the forearm. And if you look at it here in this image, this is the flexor carpi radialis. I just put both of them together so you can compare the two together, similar to this one. And this is the flexor, this is palmaris longus. Palmaris longus. And this is the flexor digitorum superficialis. It's the same as this. And this is the flexor carpi ulnaris, this one. This is actually extensor carpi ulnaris. This is the flexor carpi ulnaris. So this one. And also, this is a deeper muscles, a little bit difficult to comprehend if you do not have a 3D image, but this is the anterior view, and this is the lateral side, this is the medial side. If you remove the superficial muscles, then you can have a couple of other muscles. So this is the flexor digitorum profundus that goes all to these four fingers, and this is the flexor pollicis longus that goes to the thumb. If you have any question or comments, please write it below. If you like a topic that want to be reviewed, please write it down. If you like the content of this video, it takes time to make these videos, so please subscribe to it, give it a thumb up, share it with your friends, and thank you for your watching. Please look at other videos related to muscles and bones if you're interested. I have other videos for the head and neck, for the torso, for upper and lower limbs, as I mentioned it earlier, so you can always look at those videos.